Hello, Ann. It's nice to meet you.
Hello.
I'm Wayne Dartis. I'm your occupational therapist today. I understand that Dr. Jeffries asked me to talk to you about some pain you're having in your elbow.
That's right. When I talked to him, he said I had lateral epicondylitis.
Okay, and do you know what that is?
He explained that it was some tears in the tendons near my elbow.
That's right. And I bet that when you were in the clinic, or maybe, this is a common test, and it's called a long finger test, where you may have had you stretch your arm out and then press down on your middle finger.
Right. Yes, he did. And boy, did that hurt.
Yeah, right up in that this area.
Right up in
this bony protuberance here. This is actually part of your humerus, your arm bone, and it's called the epicondyle. This is the lateral epicondyle, and the muscles that allow you to flex your wrists like this are attached there by these tendons, and so when you put that stress on your wrist like that, it was run up these muscles to those tendons, and because they're injured, that's why you feel pain. So that's the long finger test. So let's take a look at this diagram, and maybe we can look at some of those structures. You see here are your extensor muscles. They attach down here to your wrist, and then over here they attach to the epicondyle. And this area here is where those tendons are that you've injured. Any questions about that?
Oh, I'm noticing on the top here, it also says lateral epicondylalgia.
Right. Well, there are two terms for this condition. It has traditionally been known as lateral epicondylitis, and more recent research has suggested that lateral epicondylalagia is a more descriptive term, or at least consistent term, because lateral epicondylitis is focusing on the ITS ending that focuses on inflammation. And the research has shown that inflammation isn't always a part of this condition. So they've coined this new term, lateral epicondylalgia. Lasia, that term means pain, so it's focusing on pain in the lateral epicondyle. So it's the same condition. It's the same condition. So
what are we going to do about it?
What are we going to do about it? Well, we'll go through this handout and cover some of those things. I have a question for you, though. How did you first notice or have a clue that there may be something wrong with your arm, your elbow?
Well, I first noticed it when I was at work. I work as a music therapist with early childhood. Yes, and after class is over, I'm picking up the instruments off the floor, even during class, because in between songs, a lot of times we'll switch instruments. And when I reached out and picked something up, it started giving me a jab. Okay. And it just seemed to get worse over time.
Okay. That does make sense. Okay. So you're musical. We'll have to come back to that. But to get to your question about what we're going to do and what you can expect, as it says here, most people can expect a full recovery after a 12-week course of
12 weeks.
Well, 12 weeks, but you've got an injury there, and we have to work through it, and because this didn't happen overnight, it's not going to heal overnight either. So there's a 12-week course of therapy we go through, and we can teach you ways to prevent future injury as well as heal. So we're going to start out by first managing the pain, getting that under control, and then doing some things to promote healing. And then after we got that covered, then we're going to change our focus more on getting flexibility, and then flexibility and strength going. With some of the things we're going to do is we can put on some moist heat packs on there, or maybe use some ultrasound, and that heat promotes healing. And then we can also use things like phonophoresis or tonophoresis, and these are techniques of delivering medication through the skin, right, to where it needs to be delivered. And then there's another technique of myofascial release, and that's a gentle stretching of those tendons, and it helps with healing. It reduces the pain and improves function. Now, I have personal experience with that. I didn't have lateral epicondylalgia or epicondylitis. I had medial, but it was the myofascial release that was key. It seemed to get really better after that. And then we could use also things, or we can do some cross-frictional massage. We can start massaging those things, and what that does is it encourages the tissues to get into their natural healing processes. We'll probably use some splints to restrict your movements that may be harmful, and those splints can help relieve the loads that you have there. Also, there's a thing called there's these armbands you can put around nearby there. And since you're musical, baby, do you play guitar?
I do.
Okay, so it's not exactly, but you can kind of think of these armbands like a capo. Use that. So a capo will hold on to the guitar strings, and then so it's not exactly a great analogy, but if you put that on there, what it does is it relieves some of the load back to the condyle.
Okay.
And it distributes it elsewhere. And then we'll also do some exercise programs to encourage flexibility and regain some strength that you may have lost in that. And one thing that I like to do is while we're going through all these things, we're managing pain, you and I will be having conversations. And I would like to explore some of the things that you like to do. Partly to find out what sorts of movements you might have done, activities that you may have been involved with that led you to this, and figure out ways to maybe adapt some of those activities, that you can move in different ways or do things differently. But another reason I'm doing that is because when we get to this exercise phase, there's this model it's called occupational adaptation. So I don't know about you, but I don't like doing rote exercises. You do this 15 times, and then you do this 10 times. You got to do it sometimes. But what I've found is that if we could figure out ways to do things, that you can do activities that are related to things that you enjoy. If it's music, I don't know if we can figure out some way you can play some instruments or whatever that mimic or that accomplish the same tasks as the exercises that are probably more interesting to you. And then because they're more interesting to people, these activities that we adapt, people tend to be more faithful to get them done.
That makes sense.
Yeah, so that's what that's about. So you said that you first noticed the trouble when you picked up an item like this, right?
Right.
Leg shaker.
I'd reach out and pick up egg shakers or
egg shaker. Okay, well, egg shaker, anything.
Drum
Okay. Well, now you may be hesitant to do this, but I'd like you to try to pick it up like this. Just trust me. Try it.
That didn't hurt.
It didn't hurt at all, and here's why. When you hold something like this, you're not using your extensor muscles, the ones that make your wrist extend. You're using your flexors, and your flexors attached to your medial epicondyle. That's not injured.
Mm-hmm.
So keep that in mind until we meet again next time, and then we'll really dig into this and start exploring things. Do you have any questions for me until we meet again?
No, not right now.
Okay, that's fine. If you do, don't hesitate to call our office. If I'm not able to take your call right away, I'll get back to you with whatever answer you need. And then I won't shake your hand again, but whatever the answer is, I'll get that to you. And then I will see you at your next appointment.
All right, thank you. Thank you very much.
You're welcome.